Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. Okay, today our topic is about neck and back pain, and also, more important, self-assessment. We'd like to talk about self-assessment from a standpoint of the holistic triangle. So on page 27 in the book, you have a triangle that looks like this. The triangle is an equilateral triangle, which means that the mental, emotional, spiritual component of your well-being is equally as important as the structure. The structure, as it shows on page 27, includes bones, muscles, ligaments, nerves, discs, joints, all of that part of you. The chemical corner of the triangle includes everything you put on your body or that goes into the body, how it's used on the inside with your organ functions, and also equally important, what comes out of your body. So those three main components are essential for one's well-being when we consider self-assessment. So to start with, we go to the stress release worksheet, which you've been given before. Today, on this assessment portion of it, we're going to talk about only part of this, because we do an extensive discussion on the whole worksheet in another class.
I have a question. Where does sleep fit in the triangle?
Sleep fits, well, it fits into the structure.
It's a structure.
Primarily, but as with all other components of the triangle, they always affect the other two corners.
Right. Okay.
So if you do not get adequate sleep because of a structural problem, it affects the top of the triangle, the mental, emotional, spiritual. It can also affect the chemical function of the body, of the organs internally. So everything is connected to each other. So again, today, when we talk about an assessment, on this sheet, we have number one circled. Number one, the first step is, and only look at the mental, emotional, spiritual portion of that section. To assess, you would make a list in your words of what you're doing right now that adds to your life, health, and energy. For example, if you read the scriptures, if you say your prayers, if you read good books, if you hang out with good people, that's all mental, emotional, spiritual, good things. You're doing them right now. You're actively involved on a routine basis, and that provides for your body vitality, health, improvement. It adds to your character. Now, you go over to the number two on the other side. Then you ask the question, what subtracts from my life, health, and energy from a mental, emotional, spiritual aspect? Let's talk about that briefly. Mental means brain function. Brain means the physical portion of your anatomy that learns and stores facts. It's a detailed part of your entity. So if you're looking at things with the eyes, you're reading things, or you're using words that you should not use that subtract from your character, you would put them in there. And for our discussion today, I would like to have you think of anything negative that you're doing, mental, emotional, spiritual. So think of negative words: fear, envy, worry, jealousy, grief, anxiety, any of those kinds of thoughts. Those are words. You may have words that you use in your vocabulary that you know you should not use. You may have phrases in your mind that you say, things like, I'm not good enough, I won't be accepted. Those are mental images that are subtracting from you as a whole. In the recent conference, we just heard the brethren talk. And there were several talks about the problem, some of the main problems that exist in the world today, with the wars and rumors of wars and all the contention and the disobedience and all of those things. All of that matters. And from a standpoint of self-assessment, you want to look at that, take a pencil and paper and write it down so that you have a written visual of what you're doing now that's not good. And then again, that's brain function. But it also affects the middle part of the point of the triangle, and that's spiritual. So when we listened to the General Conference and they were talking about these kinds of attributes, like we just talked about, and the potential of correcting them through love and forgiveness and charity and service and forgiving and taking on our life the power of the atonement of Christ to eliminate them. Then also you have, again, at the top of the triangle, the emotional component. So on this same sheet, the stress release worksheet, you would list any negative feeling you have toward anyone, including yourself, past, present, or future. And then you, of course, assess and ask the question, what am I going to do about it? How am I going to affect it? And then if you follow the directions in the class on this worksheet and how to work it, you'll then deal with those issues on the side one at a time. You pick the easy ones. You pick whatever the easiest in this whole group, and you solve that problem. And then when we get it solved, you move it from here down to here, and then back up. So the problem you're going to work on comes down to the bottom. That's the project for this week or this month. However long it takes you to fix this problem. The problem you fix here, you focus on it down here. When it's corrected, you move it up to the positive list. If you keep track of this over years' time, you'll see that you're getting better and better and better. I saw a lady last night, and she said, you know, I met you 4 years ago, and I'm so much different now than I was then, in all ways. Every part of her life is improved because she follows the things we teach in class. She's truly getting better and better every day in every way. In fact, I saw two ladies yesterday. One in the morning, She said, look at me. When I said roll over, look at me. See how easy I turn? When they came in, to me, turning over was a big, big deal. I couldn't do it. And mental, emotional, same thing. She had a lot of family issue, a lot of anxiety related to, people that were not doing what they should do. So, in reality, from a visual point of view, if we had a healthy child that was balanced, good in all corners of the triangle, in my mind, I consider them as a small triangle. They don't have a lot of power, but they can be balanced. Many times, young people start to develop imbalance, so the triangle gets skewed. If the triangle gets skewed, it changes shapes. So if we have the equilateral triangle, that's not perfect, but you understand. If you have an equilateral triangle and we overdo something in any area, let's suppose mom and dad put a lot of pressure on the young person to learn more than normal. So we add to this angle. If we add to that angle, we should then change the other two angles. So it's no longer equilateral. We lose over here. We lose over here. So the triangle can be distorted. Suppose a young person doesn't get enough chemical nourishment. Then the chemical corner of the triangle becomes less, and that creates problems with the other two angles. So the idea of self-assessment is to go around and around the triangle, around and around your life, and continually assess where you are. The stress release worksheet is a good way to start that portion. So as you grow up, you become bigger. When you get bigger, you have more power. The triangle has more strength, more resiliency. Now, let's talk briefly about the chemical or energetic portion of the triangle. There are a couple of things you can do very simply at home to assess your body's function inside. One of them is that I've recommended often is the pH test of the first morning urine. During the night, your body's detoxifying automatically without you even thinking about it. The body takes the toxins out of your blood, the kidneys take the toxins out of your blood the best that they can. They then store those toxins in the bladder. When you get up in the morning, you take a little bit of your urine, dip the stick in it, and check the pH. Now, that's garbage that your body's throwing out. It should be slightly acid. That means slightly less than 7. 7 is neutral. On a scale of 1 to 14, 7 is right in the middle. Now, blood happens to be right about 7.3, so blood is alkaline. But your body is throwing out the acid, and it should be slightly acid. Generally, we say between 6, 5, and 7. It's easy to tell with the test strips. And then you record it. You record what it is, and you keep a record of that from day to day. It should stay about the same. Sometimes it will change significantly. For example, yesterday I had a couple, husband and wife, who brought theirs in. On Saturday, they had a very stressful event, and they had different food and different water. On Sunday, They were both acid. Now, why is that significant? That's significant because, generally speaking, in the body, pathogenic organisms, that's fungus, bacteria, yeast, virus, are meaner, the medical word is virulent, they're more deadly when they're more acid. So the lower the number, the higher your risk of disease. It's kind of like, I tell women, it's kind of like a man. You put him in a good environment and he's friendly, he's nice. You put him in a bad environment, he gets mean. The bad news is women do the same thing. They like good environments. When they're good environments, they're happy and friendly. Virus and yeast and fungus are the same. So yes ma'am.
I have a question about that. So their diet was different. They ate probably worse food. Their stress level was higher, so their urine should have been acidic if their kidneys were working properly, right?
That's right.
So their kidneys did their job detoxifying the body.
That's right.
And if you checked it the next day and it was back up closer to 7, not quite so acidic, that means their body's functioning well, correct?
Exactly.
Thank you.
And that's a good thing, and that's exactly what happened to them. However, because of their history, one of them has cancer. Because of their current history, they have to work hard to keep the body alkaline. And to do that, we temporarily have them using a crutch. A crutch is a small amount of baking soda at bedtime to help the pH come up. Now that's not a cure-all, it's a temporary fix until we can get the body cleansed and nourished to be more stable. Yes?
I've noticed that if I use the detox tea the night before, sometimes it will make my pH be lower.
And that's
because that's what it's doing, it's detoxifying.
Exactly, and that's exactly what we just commented on. That's a good thing.
Yeah.
So the problems arise with self-assessment. Suppose you took your urine pH, it's 5.0, 5.0, 5.0, 5.2, 5.3. Then you're in deep trouble. You're fixed in a bad environment. So you're at high risk. So we add the things that move pH more toward alkalinity or improved rest, increased water, decreased stress, mental, emotional, usually less quantity of food, because a lot of people are acid because they consume more volume than the weakened gut can process, so they become more acid. The baking soda is a temporary fix until we get these other things back in harmony with where they should be. One of the biggest factors nutritionally is greens. Green foods more in season, and then of course water and sleep, and back to the mental emotional stress. You know, the directive we get here from the brethren, if that were adhered to, a lot of people would become more healthy just by forgiving and becoming more loving. Okay, so that's one low-cost, effective way to assess chemistry. Another is simply done with a blood pressure cuff. You can buy a simple blood pressure cuff to put on your wrist at the drugstore for about under $40. So you take your blood pressure and take note of it. You have two numbers. One will be the high, the systolic, one will be the low, that's the diastolic. That's the pressure that's still there in the veins. in the arteries between heartbeats. So the heart beats, that's systolic, then it lets off, beats again. The high number and the low number. If you subtract the low number from the high number, you should have a difference of about 40 to 60. That's the suggested range of difference. So if you had, let's suppose you had a blood pressure that was 120/80, that's 40 difference. That's a good pressure. They now say that 110/70 is a better pressure. What they've learned that 120/80 is common, but the healthiest people have it a little bit lower. Suppose the blood pressure goes up. Suppose the blood pressure goes up to 180/120. Is that bad? Well, it's an indicator. So when you do a self-assessment, you have a blood pressure that's high, systolic, you need to know that there's some part of the body that needs more blood. So the heart is responding and providing more blood. But if it's 180/120, you have a 60 difference. And that 60 difference means the arteries are very expandable. They're more flexible. So think of a good new rubber hose that expands and contracts under pressure. What if it were 180/160? Good or bad? Bad. Why? The arteries are stiff. They don't have that give and take. If the difference between the high and the low are less than 40, the closer they are together, the higher the risk of stroke from breakage, heart attack. That's an indication that changes need to be made. Now, the question, what enhances the flexibility of blood vessels? Again, dietarily, we go back to greens. Nutritionally, what I recommend here is a product called BFF. It stands for Blood Vessel Flexibility Formula. And that is all composed of concentrated nutrients that are all natural, just to nourish the vessels to make them more flexible. And it works. It works very effectively. And it's a temporary boost to help you, to allow your body time to heal with proper nourishment. Now, you may ask the question, could a rigid personality affect the flexibility of the blood vessels? And the answer is yes. And back to the triangle. If you have a rigid personality, does that affect the flexibility of the structure? The motion in the neck, the low back, the different ranges within the body. And the answer is yes. So that's a good chemical assessment that you can do quickly and easy. You take the blood pressure. Now, we're only half done. We then stand up. Now, when you can either do it laying down or sitting. You need to be there for a couple of minutes so your heart rate stabilizes and becomes a resting, quote, resting heart rate. And then after you've taken the pressure and you've recorded it, you then set it again and immediately stand up. Now when you stand up, that's a temporary stress. A temporary stress should, if your body is responding appropriately, what would you expect the blood pressure to do? Go up? How much? A little bit? 1 or 2 or 3 or 4? No, it should go up about 10 or more. That indicates that you respond well. You respond well to stress. What kind of stress? Well, we just exerted structural stress. Suppose a telephone rang and it was a call from a relative and they informed you that somebody has been killed in a crash. Would that be a stress? Could you expect your blood pressure to go up? Yes. What if it doesn't? What if you stand up and the blood pressure drops? That's an indication that your body right now is depleted enough that it does not respond well to stress. So what? Well, if your body does not respond well to stress right now, and you're invaded by some kind of contagious virus, fungus, yeast, bacteria, you're more likely to get sick. If you're in a car crash and your vitality is low and you don't respond to stress well, you could be sitting side by side. One of you gets hurt real bad and the other one doesn't, because one is very responsive and has the ability to react to stress, and the other one's fatigued and does not have that ability. So what do? If the blood pressure drops when you stand, that's an indication again of fatigue. I recommend a couple of things generally. One, top of the list, more rest. More rest. Now for most people, more rest means not staying in bed longer at night, because that's harder for most people to do. If that will work, you go to bed earlier, because the time in bed before midnight is better than the time after midnight when it comes to the body repairing itself, even though the hours may be the same. Early to bed has more value. That's number one. Another way to get more rest, and I recommend this highly, and that is have a nap in the daytime. You have the nap in the daytime before you get tired. A lot of people say, when asked, do you have a nap? They say, well, sometimes. If I'm really bad, 3 or 4 o'clock in the afternoon, and I feel like I can't go anymore, that's when I have a short nap. Well, short nap may keep you from dying, but it's not going to make you healthy. It'd be healthy to have a nap earlier in the day. I recommend your naps start between 11:30 and 1:30. Do them midday before you get into trouble. To keep the body out of trouble. That's the goal. Keep the body out of trouble.
I have a question. Back to the blood pressure reading. If you have a good systolic, and what's the other one?
The gap.
A good gap, but it's on the high side, not super high, but higher than what is considered normal. Then I've been to places where they automatically take your blood pressure and they'll say, oh, your blood pressure is high. They want you to take medication.
Right. Well, that's because it's medical protocol. If your blood pressure is consistently over 150, then a good doctor has to recommend you. You don't have to take it, but he has to, by his license requirement, he needs to recommend you need a high blood pressure medication. Now, the problem I have with high blood pressure medications is they're given indiscriminately. Like, back to your comment, if you have blood pressure 190, is that high? Yes, that's very high. The question is why? It could be they have a kidney or two and a stomach and a lung all need more blood. Well, of course, your body's going to respond to the need. Now, if you take a blood pressure medication that works, it may bring the blood pressure down to 150. Guess what happens to the lungs and the kidneys? They don't get the nurture they need to heal. So you prolong a problem or make the body worse. Sometimes the body you'll take the medication for high blood pressure, and the brain says, I know, but we're not going to pay attention to that medication. We're going to, because you really need higher blood pressure. So you go back to the doctor, and the doctor says, well, we'll try another one, see if another one works. That one obviously didn't work. Well, in my opinion, when that happens, it's because your body responded and said, no, thank you. I'm not going to let the blood pressure go down. So, if the blood pressure is high and you have a good gap, should you be concerned? Yes, you should be, because that's indication that something needs more blood. Should you have a high fear of stroke or heart attack? Not if you have a good gap. The gap is very important. If you have again 180 over 160, that's high risk. Okay. If somebody came to me today and they had blood pressure 180 over 160, I would say you need to go get on a drug of some kind medically, because you may have a stroke or heart attack. I'm not opposed to that. But if there's a good gap, and I've had people come here with I've had people come with 220 or 160, and that's very high pressure, but it's not high risk because of good expansion. That's my opinion. So let's go on. Let's now move to structure. And to do structure, let's talk about the hand that you have that's entitled Neck and Back Pain Self-Assessment. We have true-false questions. We're going to go through this relatively quickly. I'll help you with answers if you need help. True-false. The majority of neck and back pain is due to compensating over-defense from imbalanced posture.
True.
The answer is true. Now, underline the word over-defense. And I'm going to give you the concept. If the body posture is not neutral, not balanced, it goes one way or the other, away from balance, the body will compensate by defending. Defending means you get tight muscles. And that's appropriate. That's an appropriate response to stress. We want them to be tight. Over defense means they're tight long enough that when you lay down or you recline and they don't need to be tight, they stay tight. That happens very often. That's why Denise has people who come for massage, and she'll work them out and work them out, and she'll help get them all relaxed. Sometimes they come back another week or two and they're tight again. What does it mean? It means they spent too much time in a poor posture and retrain the muscles to stay tight when they don't need to be tight. That's called over-defense. Now we have a problem. If you have a person who has, let's say they failed the Ragland's test, they stood up, the blood pressure dropped. Now they don't have enough energy to tighten up. So now, when they lean forward, instead of the muscles tightening, they just keep on going forward. They slump on down. Now we're putting pressure on bones because the muscles don't have the energy to do what they need to do. One of our sons, Andy, a very good athlete, could go to the gym and work out hard, lifting big weights and doing lots of things, and come home and lay down and have no muscle spasm, none, just totally relaxed, because he was not in over-defense. He was not in defense. He worked out, the body responded, he stopped working out, the body relaxed. And that's the goal. So again, self-assessment. When I lay down and sit down, can I relax? Can my muscles be mobile and soft? If they can't, it's an indication that you're spending too much time in balance. Number 2, choose. Which of the following should be horizontal when sitting, standing, or walking? That horizontal means level with the earth. Ears? Yes. Eyes? Yes. Shoulders? Yes. Hips? Yes. Hands? Yes. So what does it mean? It means when you stand up, sit up. A mirror is a very good self-assessment tool. If you stand in front of a mirror and look at those body parts, they should be horizontal. Another thing to do is what I do. Have people walk down the hall. I take a video of them walking, and I look at the video very closely. I watch the hands, I watch the shoulders, I watch the head, watch the eyes, and see if they're horizontal. If they're not, then we need to find out why and make a correction. Number 3, when walking, it is best to hold the arms to your side, knuckles in forward, thumbs tight against the body.
Nope.
Nope,
Nope.
that means false, right?
Correct.
Yep. What would normal, healthy walking posture entail? First of all, with the arms, what should they do? They should move opposite the legs for a counterbalance. I have people come who walk down the hallway and they walk arm and leg the same. That's a problem in the brain. They need to be neurologically retrained. And that happens with old people and middle-aged people that have a brain problem. So we have to practice, and retrain the body. What about the hands and the thumbs? Next time you go to the zoo and you go look at the monkeys, you can see that the monkeys stand with their knuckles forward, shoulders forward, knuckles forward. So what should we do? First of all, when we stand up, first thing you do when you stand up is come all the way up. Raise up your chest. You aim your thumbs forward. You bring your shoulders back. And then you raise your head taller. You get all the way up. You then tip your pelvis down. You want to look front part of the pelvis tipped down, not up, down. Now you're ready to walk. And if you stand there for a moment or two in a balanced position, you want then most of the weight to be on the back, 1/3 of the foot. And then to make sure that your body is balanced, practice standing. If you feel like you're leaning back, then you're not balanced. When you're balanced, you don't have to work. When you're balanced, you're neutral. When you're totally neutral, the weight is back here, and you have no weight on the big toes. The 2 or 3 big toes, they don't have weight. The weight on the big toes occurs when you go forward and walk. If you stand with the weight on the big toes, what happens is your foot gets tired and you have pronation. It creates problems with the plantar fasciitis, creates problems in the ankle, which bends the knee in, and then it affects your hip. It's a chain reaction or breakdown. Number 4, when standing, the body is most relaxed when balanced, with the majority of the weight on the heels and greater toes loose. Opposite, the greater weight on the front foot. That's true. Number 5, normal foot flare while standing or walking is about 10 degrees with the feet 5 inches apart. That's also true. I had a device here. To show you, if you aim straight forward, the right foot should flare about 10 degrees. The left foot should flare about 10 degrees. That's a normal alignment for the foot and the ankle and the knee. It's often very common for people who have a tendency with the body posture to lean right, that foot will go wider. So when they walk down the hallway or stand or lay on the table with their feet up, one foot flares more. So they both should be very close to straight up. And when you stand, the heel of the feet should be about 5 inches apart, not shoulder width. The hips and legs and pelvis are designed for them to be about 5 inches apart from most people. That's number 8. True. No, number 5. Number 6 is strong and also relaxed low back and pelvis. Have a neutral lumbar curve with the pelvis tilted slightly down. That's true. What that means is when you stand, we want the pelvis, the pubis slightly down. When you sit in a chair like I am, we want the pubis to be slightly down. If you're sitting so that the weight is back on the back part of this rocking chair, like God gave you a rocking chair, if you're back here, then the low back goes flat. When the low back curve goes away, the head goes forward. That's very common for people who sit in soft recliners or chairs and slide down the slope. You want to be upright. And if you're upright with the pubis down, you can lean back. You can lean back in a recliner very properly with a lumbar curve, the pubis down. Now, what happens if you don't? If you have a slump posture with the pubis up and the low back curve straight, that creates what's called adverse meningeal tension. That's a fancy word. Adverse means meninges, that's a covering of the brain and spinal cord. Adverse meningeal tension. Dr. Alf Regg, a German pathologist, years ago did research, and he said on autopsy, people who had died with the disease all had adverse meningeal tension. Now, if you're fortunate enough to have a T-zone and you stand in neutral posture, that's feet 5 inches apart, proper flare, pubis down, thumbs forward, shoulders back, weight balanced, and you move, you reduce adverse meningeal tension. When you're doing sacral slide, and you do feet up, feet out, feet in, and you do this motion, you're reducing abnormal meningeal tension. Number 7, active self-care protocols to maintain or remodel faulty posture can be done at home in less than 10 minutes a day.
Yes.
True. Now, yeah, I give you also a handout that shows active self-care. In a few weeks, we're going to spend the whole class and review with you these protocols. I'd like you to read through them and practice them. And when you come to that class, you'll have a good understanding. If we have time, I'm going to go through that briefly if we have time today. Number 8, cranial and sacral motion, balance, and alignment. Those three words, motion, balance, and alignment, are essential in everyone for optimal health. So the head, the cranium, first of all, should have motion. When you breathe, the cranial sutures move. If they don't, if they've been jammed and they're stuck, they don't move properly, that negatively affects brain function. You can have a hip problem, you can have a gut problem, you can have a brain problem, hearing problem, speech problem, if the head is not neutral. Think of the head like a swing set in the park. The head needs to be symmetrical, aligned, and mobile. So when you breathe, and you breathe deep, it expands and moves every time. How much? Teeny bit. But if it's stuck somewhere, it will be sore to the touch, and it will not work properly. Now the sacrum is the other end. The sacrum is this group of bones right here that fits between the hips. So when you do the sacral slide and you're moving your feet forth and back and in and out, you're aligning and mobilizing the sacrum. Now just a side note, chiropractic colleges, I know for sure Palmer does it every year when they have the homecoming. They'll have contests to show pre and post x-rays. Patients who've had all kinds of misalignment and have made the best improvement. Now, why is that important? Because the more the spine is misaligned, the more sick the patient is, always. Now, the challenge is to see which chiropractic technique works the best to make corrective changes. And usually the winners are those who mobilize and keep the sacrum and the cranium and aligned. And some of the techniques only deal with the sacrum, some only deal with the head, and some deal with both. With what I teach you, we're dealing with both all the time. So you'll have the best correction. Number 9, knee degeneration is nearly always due to compensation above and below. Yeah, in other words, the spinal column pelvis, that's above, or below, that's the feet and ankles. So we rarely have a knee problem unless we have a foot problem. Now, I've told you that when you lean too far forward, you'll have a foot problem. The ankle goes in, the foot goes down, and the knee bends. So the knee, I think they call it, in kids they call it knock-knee. Oh, little Bobby has knock-knee. So when he stands, his legs like this, they go in. I have an uncle, my dad's brother, name's John. Uncle John had very bad pelvis from a fight with a cow. That cow won. And because his pelvis was crooked, his knees started to adapt negatively and they bent. And when that happened, his face also bent. So when Uncle John got old, the first thing you'd think when you looked at him was, oh man, what happened to you? And it was a simple pelvic injury that then compensated into knee breakdown and shoulder breakdown and face breakdown. So what do you do when you have a knee that's bent in? You do therapy. Quickly, I'm going to tell you what to do. You lay in bed at night with a book between your knees. You try to put the feet together. So we take this knock-knee, we'll bring the feet together as much as we can, and we do this. I call it the foot flutter. That helps to remodel the knees. When we do the knee remodeling and the pelvis aligning and mobilizing, we get correction, even if it's been there a long time. So why did I tell you that? I told you that because a lot of people could, if they did repetitive microtherapy over time, prevent knee surgery. They would not have to have it. And even people who have had knee surgery, a lot of them are crooked. A lady who comes here had a hip replacement a couple of months ago, and when they did it, they didn't do it even. So her hips, when she stands, her hip was low. How much? An inch. It was an inch different. And the doctor said, "Oh, your body will be okay." Well, no, it's not, because already the knee is starting to break down. So we raise it up. We put a little wedge in the shoe to help hold it up. And she's doing seating therapy on the T-zone to help balance it. Number 10, because of the inherent nature of all tissue to compensate and adapting, remodeling always happens. True. Now, question, is remodeling always good? No. If the tissue tolerance is exceeded, the remodeling is breakdown. It's getting worse. Like Uncle John. Uncle John's head remodeled, his knees remodeled, his feet remodeled because of a wrestling match with a cow. Number 11, stem cell production is a key component to the quality of inflammation control and regeneration. That's a true statement. Where are stem cells made naturally in your body? In the bone. Can you help them regenerate? Can you get more stem cells in any way? Yes. How? You can stimulate the bones. So you can walk. If you have the T-zone, you can just stand on the T-zone sideways and let it bounce your legs. You can take nurturing supplementation that is designed to feed the bone and stimulate the stem cell. The product we use is called MagnaStem. It works very effectively. So what do stem cells do? Stem cells are like missionaries. They go where you want me to go, wherever I'm needed. They become different kinds of specialized white cells. Some of the white cells fight virus. Some of the white cells fight fungus. Some of them fight yeast. Some of them just check around looking for terrorists. Some of them are assigned to remember. That's why if you've had any kind of exposure to any problem like COVID and you recovered, your body knows what that virus looks like. And if you get exposed again, it's going to identify and attack it and destroy it early. Especially if your body's alkaline. So it's all correlated. So when we go back to the triangle, we want to go continually do self-assessments and make self-modifications. It's just as simple as maintaining your car and driving down the road. You have to be alert, you have to be attentive, and even though in fact, most things happen automatically in the body to maintain survival, to be healthy, you need to be alert and help the body do what you can help it do to maintain optimal health. Are there any questions as we close? Any comments?
Is there a better time during the day to do your blood pressure? You said the morning was the best for the urine. Is there a good time, better time than another during the day to do your blood pressure?
I personally recommend about the same time in the morning. That's when you should.
Just consistent time in the
A
morning.
consistent time. And if you do it, say 3 o'clock in the afternoon, you don't have consistent activity during the day. So it's okay to do it then. It's never wrong to do it. But to monitor it, if you're going to monitor it, so like with the urine, we always do the urine first thing in the morning. So I recommend early morning blood pressure for Ragnar's test. Okay? Thank you very much.